Hello, my name is Josh Montano, and today I'm going to be presenting my research on readmissions of high-risk patients within a healthcare facility. Before I get started, I like to go ahead and start with explaining what a readmission is and what a high-risk patient is. A readmission is a patient that is discharged from a healthcare facility and has to come back to the healthcare facility for more treatment or treatment due to the fact that it wasn't taken care of the first time. These patients are patients that return back to the hospital within 30 days. This causes a problem just to the healthcare facility as a whole, because that's saying that someone's not doing their job. A high-risk patient is going to be a patient that is vulnerable. Most of these high-risk patients are CHF patients, which are cardiac failure patients, which you see a lot of within a healthcare facility. And you don't want those patients to be returning back to the hospital. Now, after my introduction, I would like to go ahead and explain that since this is a complex problem, I did use an interdisciplinary approach. The way I used an interdisciplinary approach is by integrating and synthesizing both of the disciplines that I used. The two disciplines that I used were healthcare administration and human resources. I'm able to combine these two things to solve one problem, or the complex problem in this case. I'd like to go ahead and talk a little bit about the research that I found. I found that high-risk patients do come back to the hospital more than most likely if it's a healthcare facility, that these patients will just keep on coming back to the hospital, not due to the fact of just the care, but that they feel like it's a vacation, that they'll be able to go to the hospital and they'll be taken care of and they don't have to take care of themselves. That's some of my research that was in some of my research that I found. I'd like to go ahead and talk about the insights between the conflict by using healthcare administration and human resources. This is important that we do find insight within these two disciplines, because finding insight pretty much tells us what the outlook each discipline has on this complex problem. So healthcare administration's insight. The insight that healthcare administration has is more focused on the patient, making sure that the patient is getting taken care of. Unlike the healthcare administration's insight, human resources insight is more focused on the employees, making sure that the employees are trained, making sure that they give them the opportunity, the healthcare providers, the opportunity to make sure that these readmits do not come, or these patients do not become readmits, especially if they're high-risk patients, because we don't want high-risk patients to come back to the hospital. So since there are insights, there are also going to be conflicts within the insights. Healthcare administration's conflict, since healthcare administration is more focused on the patient, and like I was saying earlier when I was doing my research, we found out that that these patients don't want to take care of themselves. They feel like it's a vacation just going back to the hospital and letting someone else take care of them. See, that's the problem right there. We need healthcare administration's conflict is that they're not taking care of themselves. So if they're not able to take care of themselves, and then they're going to be coming back to the hospital, especially within those 30 days. One of the conflicts that we found with human resources are, since human resources inside is more focused on the employee, training the employee, making sure that the employees get the training that they need. The conflicts that they see are actually going to be communication through the line of management, making sure having that communication and that leadership to make sure that they do get trained, that they do stay on top of getting trained, and just having that communication as a whole. And that's something that I found in my research that was one of the biggest conflicts with most all human resources, not just within a healthcare facility, but it is within the healthcare facility as well. My next step was creating common ground. Creating common ground is important because this is where we synthesize and pretty much combined these two, or integrate these two disciplines. Since this is going to be a complex problem, it is important that we do use this interdisciplinary approach by using integration and synthesizing. The way that we're able to do this is by using extension. Extension is a process of extending a definition of an idea to create common ground within the two disciplines. By using extension, we're able to look at healthcare administration as a whole and see human resources as a small part of it, giving the training to healthcare administration or to administrators, faculty, on educating patients to not return back to the hospital. So to best explain this, the way that human resources is doing some of this stuff is by just providing them with information, going on trainings. I know in some of my research, human resources do send healthcare providers overseas to get some of this training on how to just to know if a patient's going to be able to take care of themselves, just for more additional training and stuff. So I'm going to go ahead and conclude my conclusion. Healthcare administration and human resources are working together to try to lower the readmission rate, and especially of high-risk patients. This is a big problem that healthcare administration does face, because they do get fined by insurance companies if patients keep returning back to the hospital. Insurance companies pick up on that, and the healthcare facility does end up getting fined in the long run. Another thing to conclude is that they are taking these steps, and they are finding out what they need to do to make sure that these patients do not return back to the healthcare facility. And through the paper or through the research, I was able to integrate and synthesize these two disciplines. That's all I have for you today. Thank you, and you have a nice night.